Hello, you guys. How are you all? Thank you guys for being here. We are starting at 5:34. I figured that would happen because I was kind of rushing around, trying to get my drink, trying to get ready. All the things. I don't think there's enough hours in the day. I can't seem to find enough. I am constantly rushing to get everything done, to grocery shop, that kind of thing. So, anyways, like I've told y'all, it's a hot mess express over here. Come on over and join the ride. And thank you for accepting me for how I am. So thank you guys for being here. Today we're going to continue our coverage into our review of Wade Wilson's trial. We're going to start, once we get to the trial, with the medical examiner, and he's going to talk about Diane and her injuries and her autopsy. We're going to hear from Fannie, the homeowner, where Wade broke into her home and, made himself at home. And we're also going to look at something we missed yesterday. So we're going to start out actually with, let me get to it, with the new segment I told you guys about yesterday. We're going to do this every day, the comments section, where we hear from you guys in the comments. So even if you're here for the live, please feel free to leave your opinion on what we talk about in the comment section, and I'll choose a handful. We've got, I think, 3 today, not many, but a few comments for us to look at, go through, and talk about. And one of them is going to lead us to a piece of court footage that we missed. So let's go over here. Our first comment is from Salmonella, and she says, facial tats are a red flag for me. Too bad he didn't have those before he met Christine. And, I have to agree, it would be a red flag for me too. And we have to think about it. He did not look like he looks now at the time of the crimes, so I agree, Salmonella. Our other comment from Tasha Lawson, she says, hi, Alex, you plucked the words right from my mind. At the exact moment, I thought, that could have been anybody. You said it word for word. It's striking to think of what he did and how he did it and how anyone could believe in his innocence. He's as guilty as they come. Oh, sorry, you guys, I dropped an ice cube. And I responded to Tasha and said, Tasha, it's so true. Could have been me dozens of times at another time in my life. And yeah, I can tell you so many times where I've hitchhiked, been walking on the side of the road, just doing pretty reckless stuff. And it really could have been me, or, any of us. And that is just so scary to think about. It's something that has sparked something in me I've always cared about, which is like self-defense for women, but, or for anybody, for men and women. But I want to do something there. I want to do something with the channel and some sort of self-defense. I don't know yet what exactly, but I think it should be something that's important to all of us, So I definitely want to make something happen. I don't know yet. And then our last comment comes from our friend Grace. And this is what's going to lead us into some of the footage we didn't see. And some of you guys had mentioned this. So she says, I didn't see it here. But while Mila was testifying, the defense asked to approach the judge, and even Wade Wilson approached the stand. Mila later said she was terrified at that moment. And Dolores responds and says, he probably did it to scare her. He's a big dude, but he won't beat a woman in front of a man, especially sheriff's deputies. He wished he would have tried something. And we continued to talk in the comments, and this is where she emailed me what we missed. So that is where we're going to start today. Duty Ron had Mila on, and when she was on Duty Ron's, he pulls up the clip where Wade walks up and asks Mila how that felt. So we're just going to watch that quick segment. I have linked his entire interview in the description for anybody who didn't see it, that wants to watch it, that kind of thing. I'm hoping and praying the internet cooperates because it's storming here. But let me get right over to this. And let's listen to this. Unusual courtroom scene with a double murder is what he's titled this segment.
In his audio, he goes, this this belt is giving my hernia problems. They go, well, Mr. Wilson, if it's giving you that many problems, then we're going to have to use the other alternative and handcuff you and shackle you. And he still agreed to do the shock belts.
Yeah, because he didn't want to be handcuffed. He wanted his hands free. And he was putting his hands in his pocket. His hands were out. Let's look at this because it shows the sidebar.
End up going to her house.
Yes.
And did you spend the night at her house?
Yes.
Where did you stay?
On the couch.
Now, did you ever hear again from Wade Wilson?
At roughly 6, my phone starts either texting or calling. Around 8:45, I start noticing and I start answering his phone calls.
Okay, so the first calls that he's making or text messages he's making, you don't receive those or talk to him at all?
I was sleeping.
When you
I love that. I love that you just snap right back. No, I was sleeping. I didn't hear his badger.
Well, another way that I could interject a little bit is
I'm a big fan of Duty Ron. I think he has an amazing channel. I really do.
a bit like crude or like just matter of fact. It's like how I've answered this damn conversation how many times. So, and people were like, she sounds coerced. She sounds this. No, I've just had this conversation 500 times. That's why, you know?
Yeah, I think you testified very well. And I was telling you guys earlier in the day, I've testified at hundreds of trials as a police officer. And then one of the very first times I testified, I was nervous myself. So getting up there, you did a great job. And so did everybody else. Papa Steve, I know he was really nervous. I talked to his wife about it. Very nervous. And he did.
That he was going to have a heart attack, you know, like he was not okay.
Yeah. But you all did a great job because the end result was a conviction. And you guys were instrumental.
A little bit. The reason I'm skipping to the exact part where he walks up, this is something we may circle back to. So remember, I told you guys, we're going to go back to the 911 call. We're going to go back to Mila's police interview. We're going to go back to things that were brought up during the trial that they didn't show. Today, we're going to see some body cam footage of some of the situations, and not all of it. I'm sure there's, a lot more out there, longer versions of it, but they do play some in court. I didn't watch ahead. I just kind of skipped around to see what we had to look forward to. But okay, so here's where they talk about him coming up. I'm going to drop the link to this exact interview in the chat, but again, Duty Ron's channel is in the description.
And I can't remember the threats per se, but it was very intimidating.
I don't know her, but
Did he appear to sound angry?
Very angry.
Did you feel scared at this point? Now, the phone number that I'm going to, Judge, may I approach?
This is where it happens, folks. I'm going full screen.
For the record, show defense counsel with the previously marked the state exhibit 20.
Mila, now you're witnessing them walking up here. You had to have seen this happening right in front of your eyes.
Yeah.
What do you
And
think?
also, my husband and Amy were sitting in the, the victim side, obviously. And when things got too, like the energy, I would just focus on them because.
Can you imagine? I can't imagine even looking at him from across the courtroom. But as he's approaching, you can almost see it like in her face.
Like you said, nobody else have ever seen somebody of this magnitude be able to freaking approach a witness. I was scared to death. I was.
Yeah. I was mortified when I saw this.
I'm going to show you state exhibit 20, and I just ask if you look at it and tell me if you recognize that phone number.
That is my phone number.
Okay, and is that the phone number that he was calling you and texting you?
Yes.
And at this time, the state would move 20 into evidence.
Here we go. This is where it happens. They question something here, and they have a sidebar, and they go up. And you can see his hands are free and clear here. There's no shackle, the shackles on his legs. But here they go.
Yeah, he's writing something. Okay, so
Now, when you look at this, you'd think the defendant's going to sit at the table. They allowed him to go up here like we're talking about, and this was mortifying. Like I see right away, you turn this way, you turn away from him.
Yeah.
And you said you were focusing on your husband and Amy, right?
Up so much. I felt like I was going to pass out. I was like trying everything that I could do to sell. It was so bad. I can't even.
Wow, you guys.
Yeah.
Look at her. She's just looking totally away. Is he looking right at her? It looks like he is staring right at her. It's possible the judge, because, the angle that we're at, but wow. Okay. So now we're going to jump right back into the trial. I've got it where we need. We're going to listen to Dr. Coyne. He's a medical examiner who did Diane's autopsy. Let me see.
Good morning, sir.
Morning.
please introduce yourself to the ladies and gentlemen of the jury by telling them your name?
Sure. How you doing? I am Dr. Thomas Coyne, Coyne.
Dr. Coyne, what do you do for a living?
I am a medical examiner. I am the current chief medical examiner in District 2, Tallahassee.
I'd like to direct your attention to October.
Quick question. Do you guys want me to keep it full screen? I mean, because I think that's better than like say this where you just see my picture. I'm not on camera anyways today. Or this, I suppose. But yeah, what do you guys think? I think I'll keep it like this so you can see a little better.
2019.
Oh, shoot.
Where were you working at that time?
I was the deputy chief medical examiner here at District 21.
Would you please describe your training and educational background for the ladies and gentlemen of the jury that allows you to do the work that it is that you do?
Sure. Started out first with medical school. I completed my MD at Robert Wood Johnson Medical School at Rutgers University. At that same time, I also completed a PhD in toxicology and pharmacology. I then went on for a general residency in pathology or anatomic pathology at the Hospital University of Pennsylvania. At that same time, I completed a fellowship training or subspecialty training in neuropathology. After that, I went to the Miami-Dade Medical Examiner's Office for training in forensic pathology. So right now, I'm board certified in anatomic pathology, neuropathology, and forensic pathology.
Wow. Wow, wow, wow. Very impressive. Just a quick warning, medical examiner, I think this may be some tough testimony. There's a trigger warning up. Some of you guys wanted to be warned, so I just wanted to, make it really clear. Okay.
All right. It's a lot of pathologies. Please describe for us what pathology is.
Sure. It's a branch of medicine, as internal medicine and sort of general medicine. Pathologists work behind the scenes. We have the same training as other physicians, but our job really is to determine or identify disease in tissues or in a deceased person. And we use our knowledge as a physician as well as other tools such as the autopsy procedure. We use our microscope to do histology to look at the tissues themselves and other tests like microbiology testing or genetic testing. And together we put all that information together with other physicians, hopefully to either identify your disease if you were in a hospital, or in my case as a forensic pathologist, to determine cause and manner of death.
You just anticipated my next question. What exactly is forensic pathology?
Sure. Forensic pathology takes all the tools that you learn as a pathologist, and we also study how injuries occur, so mechanisms of injury, how force creates injury, whether it's a blunt force or a sharp type force. We also learn about gunshot injuries, environmental injuries like fire and chemical injury. We have training in toxicology. We learn about the process of decomposition. And we use all of that, again, to figure out how a person dies.
Brings me to my next question. Anatomical pathology is what?
That's just general pathology.
And when we're talking about neuropathology, what are we referring to?
That's specifically pathology of the brain.
How long would you say that you've been a doctor?
11 years now. Well, since 2009, a doctor, but training as a forensic pathologist for 11 years. They go by so fast.
How many years have you been in medical examiner?
11 years.
All right. So in that time, can you tell us approximately how many autopsies that you've gone ahead and performed?
Ooh, it's approaching 4,000 now.
Now, back in October of 2019, you indicated that you were the deputy chief medical examiner here in Lee County. Is that correct?
Yes.
Now, at that time, did you have an opportunity to perform an autopsy of Miss Diana Ruiz?
I did.
In general, could you please describe for the ladies and gentlemen of the jury the purpose of conducting an autopsy?
Now, before we get into Diane's autopsy, I just want to say thank you guys. Thank you for doing this with me, going through, I know some of it's tougher to listen to, some of it's more interesting. So, whatever, depending on the person, it may hit you differently. But I have enjoyed this so much, like hanging out with you guys and watching. I feel I've learned a lot. And there hasn't been a second of like, I don't want to say boredom, but like there hasn't been a second where I wasn't just completely interested, just dialed in. So yeah, thank you guys. And a special thanks to Melissa, because honestly, it was her idea to do it this way when I told her I wanted to watch the trial. And yeah, thank you guys. Okay.
Sure. An autopsy, ultimately it's to determine the cause and manner of death. But an autopsy is a procedure in which I examine a deceased person initially, much like I would a person who walks into an office, to see your physician. You start with examining the person externally, making note of normal body features, their body habitus, and then begin working to see if there are any unusual features like congenital defects or injuries. You catalog everything you see externally, and then you work internally, examining all the internal body cavities to, again, look for normal features as well as any signs of disease or injury. You add to that any microscopy or histology, looking at their tissues under the microscope. You sample their bodily fluids or tissues to do toxicology testing. And then you take all that data together and you hopefully arrive at a cause and manner of death.
Would you please describe for ladies and gentlemen the difference between cause and manner of death?
Sure. Cause of death is what actually led you to die on that particular day. So for instance, let's say if you had heart disease and you had a heart attack. Well, physicians, we call that a myocardial infarction. So our cause of death would be myocardial infarction due to coronary artery disease, and that's your cause of death. And in that case, your manner of death would be natural. Whereas let's say if you died in a car accident, you had head trauma, and perhaps maybe your cause of death is traumatic brain injury due to a motor vehicle accident, then your manner of death will be accident. In Florida, we have 5 manners of death. There's natural, accident, suicide, homicide, and then lastly, undetermined.
Oh, okay. That makes sense. Natural, accident, homicide, suicide, and then undetermined. Like, so for instance, if your cause of death was gunshot wound to the heart, then your manner of death would be homicide. Oh, and another reason I wanted to pause, it's going to be interesting because so he's going to talk for a minute more. They're going to go through Diane's autopsy photos and talk about that. But then this medical examiner is going to opine on Christine's autopsy. So remember, Tess had actually told us in a comment watching Christine's that we will hear more from another medical examiner about her injuries. So that's going to be now. Well, in a few minutes.
Now, let me draw your attention then to the autopsy of Miss Diana Ruiz. Did you perform that on the 11th of October of 2019?
Yes.
Would you please describe for ladies and gentlemen of the jury how you began the autopsy of Miss Diana Ruiz?
Sure. The body was transported to our office under homicide protocol. So it was in a body bag that was sealed with a lock. So the first thing we did was unseal that lock, open the body bag, and begin examining the body in its natural state, that is wearing clothing, sort of slowly documenting the clothing the person was wearing, removing the clothing from that person, placing that aside for additional photography, and then moving in towards examining the body.
What injuries did you note, if any, on the external examination of Miss Diana Ruiz?
Sure. Most notably, so she was in the stages of putrefactive decomposition. So her tissues were being decomposed and degrading. She had some evidence of animal or scavenging activity on her body as well. And so portions of her ears and nose were removed already, most likely by avian scavengers. But I could see externally first.
Oh, my dear God, her poor family. Remember, they've testified. So a lot of times the way it works, if you're a witness, you can't watch until after you testify and you're released. So they've been released. I'm sure they want to be there and hear this. My God, I cannot imagine. My heart goes out to them. And yeah, that's interesting. So scavenging from avian, what did he say? From birds, basically.
First and foremost, that she had fracturing of the nasal bone. She also had a laceration underneath her left breast. She also had bruising or hemorrhaging in the skin on both sides of the left and right sides of the body.
Was that the extent of the external injuries that you observed? On
The most significant external. There was, of course, a lot of significant internal injuries.
And did you document all of these
Well,
by way of
I apologize. She also had, what I didn't talk about was bruising on the back of her left forearm, bruising on the back of her left hand. I can also see that she had a fracture of the fourth finger, the proximal part of the fourth finger. And she also had some bruising on her right arm as well.
After you noted these external injuries, did you ultimately document those particular injuries
Yes.
by way of a photograph?
I did, yeah.
Now, before we get into the internal examination, did you also document the internal examination by and through photography as
Yes.
well? So if I may approach defense counsel, Judge.
You may.
I'm showing them what's previously marked case number 30, 30A.
After reviewing these exhibits, defense counsel objects to having Diane's autopsy photos admitted into evidence and shown in court. The jury gets excused while prosecution and defense argue the case law to the court. The judge ultimately rules that the photos are admissible. So he's cut the trial channel, which is also linked in the description. They have cut that out, the break. But they're kind of explaining to us what's happened. So they didn't want the photos. Yeah, because they're probably horrific, gruesome. And, I'm glad that the judge allowed them to be shown. Because as awful as it is, we need to see these monsters for exactly who they are. I can't stand that. We've seen in other cases, like in Leilani's, for instance, some text messages were kept out at first. And that kind of shifted. But it's like, why are you? No, like, I understand the point and it has to be a fair trial. But also part of me is like, I want to know the truth, no matter how awful it is about these monsters. Every detail is important. Hey, Amber. Hey, Harley Quinn. I want to know too. Watch Dear John, the Betty Broderick story. Her trials are also on YouTube. Allegedly, Annie actually just wrote her name down. I'm going to check it out. Thank you so much for sharing that. Okay. You're my kind of girl. You said your friends were worried about you because of the books you were reading. That's kind of like how my family seems to think of me, because of the being into true crime and kind of going to sleep to Forensic Files. And before I found YouTube, that's what I always went to sleep to. But very cool. Okay, so now we're going to get into them talking about the photos. I don't believe anything's shown. I think it's just his reaction. They're going to show Wade looking at the photos.
30B, 30C, 30E.
And I'm going to take the banner down. We know the medical examiner's name at this point. Sorry for interrupting again, but I just want you guys to know what's going on. His name is Dr. Thomas Coyne. I want us to be able to see Wade clearly. I'll also remove my picture for this part. Okay.
30G and 30H.
You may.
Dr. Coyne, I'm handing with the previously marked states in 30, 30A, 30B, 30C, 30E, 30F, 30G, and 30H.
Okay.
I see you take a look at those items and see if you recognize those.
I do. So these are all photographs that were taken on the day of the autopsy in the morgue here in Fort Myers.
And do those photographs fairly and accurately depict the autopsy conducted upon Miss Diana Ruiz when you conducted it back on that day?
Yes, they do.
Judge, they moved all those
Yes,
items and evidence at this
the-
time.
Very well. And your
Sorry,
previous
Beth.
objection is noted. Other than that, any other objections?
Tell me why a medical examiner who's done this for years seems to be more bothered than Wade does, like when he's looking at this stuff. And we'll see his facial expression. He's obviously proud of what he's done when we think about the door to his jail cell. But Nanya, I'm so happy to see you. Nunya says, you know what my mind thinks? How did those Wade wives watch this and not see what the rest of the world seen? So broken. I know. I don't think they watched. I personally think a lot of them probably wanted to avoid the actual facts. They kind of watched the edits on TikTok, him walking in with the music and, all that kind of stuff. I don't know. I guess that's the only way my mind can comprehend those women, Okay. Where I'm not
On this list, there
for a
was
minute.
an F. I don't recall an F on the
I'll let
initial.
you take a look.
It's already been previously.
Right, but you just said.
I'll
F.
let you all walk over and show them what you're. Okay. All right. Other than that previous objection, which is still noted, any other objection?
No,
All right. They'll be admitted.
no additional objections.
Yes, I understand.
Commissioner Process?
You may.
Commissioner Motion?
You may.
Dr. Coyne, I'd like to direct your attention to the screen. What are we looking at in this photograph?
This is a photograph.
So just to let you know, when he looks that direction, it appears that is where they're showing the autopsy photos. And remember, this was a horrifically gruesome crime. It was. But then you have the fact that she was decomposing and there was scavenging happening and stuff. And so you can only imagine how horrible these photos are to see. Just want to keep that in mind while we watch him. Watch.
Of the face of the decedent taken on the autopsy table.
Oh my God.
You can see
Do
here.
we have that identified? Which exhibit that is?
It's 30.
Yeah, because we can't see the exhibit sticker on them. Thank you.
And the picture shows the exposed nasal bone, which you can see is fractured.
And we look at State's Exhibit number 30A.
Sure, this is a view of the body again, lying supine on the autopsy table. This gives a view of the neck and torso. And here you can see under the left breast, there is a horizontal laceration.
And 30B.
I'm really curious. I thought this the first time they mentioned it, so I'm going to go ahead and take a moment to say, wonder what that laceration is under the left breast. And I wrote it down in my notes the first time he said it. Now, if anybody knows, please let me know. But yeah. Adrian, thank you for being a member for 15 months. And I love you. Thank you. I appreciate you so much. Nurse Kristen, can't believe it's been 13 months. Thank you for being a member for 13 months. And I appreciate you so much. And then Girls Nana, thank you for being a member for 14 months. You guys are the bomb. Thank you guys. Was this when he got, I don't know, Chedescadum. I'm not sure. I've heard about that, but I haven't seen it. So Harley, where he's looking right now, where I have it paused, that's where the photos are. He's an absolute monster. How the F can he look at it so nonchalantly with no emotions? Think about it. The medical examiner is just, you could just see it on his face. It's not even easy for him to look at. W says, what is the conspiracy Wade Wilson said that makes people question his guilt? Not a clue. I do know that they try to say he didn't have good attorneys. I heard that on Melissa's last night. Yeah, I don't know. Not a clue. He's excited. You can tell, Bubba says. Okay, and then the last one, or the last thing I want to read before I go back is Preschool Granny. Thank you for being a member for 19 months. She says, love everyone here. It is an awesome place. Thank you guys for being here. Hey, Roro. Okay. Oh, Michelle L. If I was a member, I think I'd be 13 or 14 months too. Well, thank you, Michelle, for being here and supporting me in the channel. I appreciate it so much. Okay, let's go.
What are we looking at in this photograph?
This is a more closer view of that same laceration under the left breast.
Now, doctor, when we're looking at the photographs, when a body is in a state of decomposition, what is the body doing at that point in time?
Sure. So all of our body is covered with bacteria and lined with bacteria. And so when you die, the ability of your immune system to protect you against those bacteria stops. And so that bacteria basically multiply and travel throughout your body, literally consuming your tissues. And so that is the process of putrefaction that we are seeing here. At the same time, too, because you are deceased, the enzymes in your body, as they're being released from your cells, will also aid or add to that process.
And is there also a series of bloating that occurs as well?
Yes.
And how does that happen?
That happens because the bacteria that are present within our gut that travel throughout our body are anaerobic bacteria, so they will produce gases like methane and hydrogen sulfide during the process of putrefaction.
Now, direct your attention back to the screen here at 30C. What are we looking at in this particular photo?
So this is a photograph now of the decedent on her stomach, and you're looking at her back and the back of her head. Her arms are up in the air. So her right arm is present. And although you see discoloration, within that area of discoloration is actual bruising or contusions of the back of the right arm as well as on the right forearm. She has bruising or contusions on the bilateral upper back regions or the trapezius muscles, which are in that area. And you can see on the left side, there's some red purple discoloration, which is also contusions.
And would you please step down, if you would be so kind as to point exactly what it is that you're talking about with regards to the various contusions?
You have to speak up loud because there's not a microphone there.
Absolutely. So as I mentioned, here is the right arm, and here is drying or desiccation of the skin. But you can see here, there's
Just a second. So remember, the last time when the female medical examiner got up, we had to boost the audio a little bit because you can't hear once they're up there. So I boosted it a little bit. Hopefully it makes it a little better. Can't do it too much or it just becomes terrible quality. It's already going to make it a little worse. But this way you guys can try to hear. And then I'll try to recap as well.
this red purple discoloration, which is the hemorrhage or bruising. And she also has that mixed within this area of dry ear in her on her forearm. You can also see here now, looking at the back, this area right here and here, which is that same contusions or hemorrhage. Because when you reflect the skin, when you're doing the internal examination, you can actually see the hemorrhage within the fat tissue underneath the skin, letting you know that it's real hemorrhage and not just artifact of decomposition.
Now, on this particular photograph, closer to the left-hand side in the upper left, we note that there's an extremely darker discoloration. Is that discoloration that relates to a tattoo, or is that relation to actual hemorrhage into the body?
This area right here is a tattoo.
And what's been previously admitted as states exhibit number 30D, would that be an up-close photograph of that particular tattoo?
Yes, it is.
Look at him. Oh
Now,
my.
doctor, before you go anywhere, you indicated that you conducted the internal examination of Miss Diana Ruiz.
Yes, it is.
What did you find as it relates to any type of internal exam or injuries to Diana Ruiz?
Sure. So the internal examination of this case, involved reflecting the skin of the neck, as well as the skin of the chest and the abdomen. particular, we were able to see that there was hemorrhage on the right side of the neck within the fat tissue, as well as the large muscle here on the right side of our neck called the sternocleidomastoid muscle. In addition, we have a bone in our neck, a free-floating bone called the hyoid bone. It's a C-shaped bone. The left side of that bone was fractured. That bone sits just above our thyroid cartilage. So in men, we have the Adam's apple more prominent than.
Now, I think when the hyoid bone is fractured, just from other cases, that seems to be common when strangulation is involved, because we've seen it with Christine, we saw it with Maddie Soto, we did not see it with Shanann Watts, but we've seen it a few times.
And females, but you also have the same thyroid cartilage. The top of that thyroid cartilage has two horns.
Just to show the amount of pressure, because, and to point out that Shanann Watts did not have any broken bones in her neck, because you can just cut off the blood supply or the oxygen. You don't have to squeeze that hard and be so vicious. That's just a statement to how absolutely vicious he is.
And those horns sit right below that hyoid bone in her neck. These two horns were fractured. As well, she had a large number of rib fractures. So she had fractures to the 1st through 11th ribs of both the lateral and posterior aspects of the torso. She also had some anterior rib fractures. This photo here is a picture of the neck. If you can imagine, the head is here.
Hold on one second. What exhibit is that?
That would be state's exhibit number 30D, Your Honor.
Thank you.
It says F.
30F.
30. I apologize, 30F.
You can see this is, if I make a Y incision on the body here, I'm pointing to it on my torso, and I reflect the skin backwards. That is what we're seeing here. And this is the neck. You can see that hemorrhage I was referring to in the soft tissue or fat tissue, as well as within the muscle.
How much pressure, or what would it take to cause that kind of damage?
I'd say probably far greater than 10 to 15 pounds of pressure, because you have also a corresponding fracture of the hyoid bone and the tracheal bone.
You indicated that.
Basically making the point that for you to have those fractures of those two bones, the hyoid and the tracheal, I think is what he said, it takes a lot of pressure, at least 10 to 15 pounds, he said.
Hyoid bone as well as the.
Here is the thyroid cartilage, and I don't know if you want to show the figure number, but
That's going to be state's exhibit number 30G, Your Honor.
If we all feel that on the front of our neck right here, that ridge. So this is the front, this is the back, and these two horns are fractured. And here's our trachea right here, our airway. Right, that's the hyoid bone, which sits right above this, and you can see there's hemorrhage in the left side of the hyoid bone, which shows it's fractured. You can see the hemorrhaging there, and hemorrhaging down there. And there's the fracture right there.
Watch him.
You made mention in state's exhibit number 30E that I'm showing you here, that you noted that there were several rib fractures.
He's looking at every detail. And if you look, even the attorneys aren't watching like that. Even look at the guard behind him. He's not looking over there. But look at Wade's face. The look on his face is just like, it's got me shocked. I can't believe it. I know that he's a monster, right? But it's just seeing it like this. I don't know. He's innocent. So why is he looking? And there's a couple comments I wanted to acknowledge I thought were really great comments. So Nurse Kristen says, I don't think murder suspects should be allowed to see the crime scene photos. I know at this point he's innocent, but the way he's looking at them is sickening. And then Jay Rose, I don't think defendants should be able to retain their own crime scene photos unless they're their own counsel, which we saw with Letitia Stalk. She was only able to get her discovery because she was her own counsel. He's obviously taken those photos as taking them out of the discovery, not taking them like took the picture, but took them from the discovery and used them as trophies in a way, hanging them all over his jail cell. I think knowing that makes it even adds another element of just disgust. And then the last comment, Bree, this is a great question. Do you think he's questioned himself at all? Like, how could I have possibly done this? I don't know. That'd be a better question for the chat, but I'm really curious what you guys think in the chat, because especially if you've listened to all of his calls and stuff. Tess, what do you think? And you guys, other people who have, let me know.
So this is now a picture after the skin of the body has been reflected. We've removed all the internal organs, and now you're looking, here's the spine, and here are the posterior aspects of the ribs. This hemorrhage here on both sides corresponds to all of the rib fractures. And you can see these little gaps here. These are the actual fractures on both sides. And there are fractures in rib numbers 1 through 11 on both sides.
Now, as we're looking at State's Exhibit number 30E, you indicated that there are multiple rib fractures. Is that on just one side, or is it front and back?
So on the back, there are 1 through 11. And then if you can imagine, the ribs kind of curve around. The lateral aspects also have similar fractures, which are not as well visualized here. You can see some of those fractures in here.
So essentially, when we're referring to multiple fractures, we're essentially looking at 2 sets of fractures on one side and 2 sets of fractures on the other side. Is that fair? What kind of force would cause multiple fractures such as those?
A significant compressive type force, because if you can imagine, the body's laying on the ground and my hands are the ribs, because of the top of the ribs and the bottom ribs. You have fractures in the top, lateral aspects, and the bottom. So it's more or less a compressive force that caused all those fractures together. So a significant weight bearing down, or force bearing down upon the body.
You'd like to take a scan again, Doc?
Okay, just a moment, because I have to turn off our booster. It just destroys the quality. I mean, it wasn't too bad just now. Hopefully it made it a little louder for you guys, but I'll just put it back to normal. And we'll keep listening, because we're getting to where he's going to opine on Christine's autopsy, and I'm very interested to see what he has to say there. Hey, Lil Red. Hey, wait a minute. Where'd you go? What the heck? I just saw a comment I wanted to respond to, and it went away. Hey, Boo Sheet. Okay, let's keep listening.
So would you say that, I don't know, an automobile driving over a body could it cause that kind of?
That would certainly cause that, yeah.
I'm going to also show you 30H.
That's, yeah, it's a photo of a ring that we obtained during the autopsy, removed from the body of the autopsy.
And that's one that was taken, 30I, that was also previously admitted.
That's correct. Yep. Also removed it.
Now, doctor, when we're talking about damage to the thyroid cartilage as well as to the tracheal aspect of the throat, could you tell us approximately what it is that would cause that kind of damage?
Those are the types of injuries that we classically see in strangulation, where a person will place pressure across another person's neck, whether it is using a ligature or even using a hand by grasping the neck very firmly and squeezing down upon those structures.
And does it take a tremendous amount of force in order to cause fractures to those particular items?
The fractures, yes.
Now, the hemorrhaging that you saw in the neck area underneath, how much damage or pressure would you say would cause that?
For the type of bleeding you see there, less pressure than it takes to fracture a bone. But the pressure, the real issue is the pressure it requires to compress the carotid arteries, because ultimately what happens is those carotid arteries that course down the side of our neck takes about 10 pounds of pressure really to compress those. And so if you compress those, you can also, with that same amount of pressure, you're also tearing apart those fine capillaries and small vessels.
Which is what happened to Shanann Watts. He basically compressed that artery.
During the muscle around those main arteries. So that's causing the hemorrhage you see in there, but it's also compressing those carotids, preventing blood flow to our brain.
Now, given the various contusions and bruising that you saw around the body in your external examination, would those have been consistent with, say, someone who was actively trying to defend themselves?
Certainly the ones, on the arms would be in the distribution that would suggest that, on the backs of the hand and the forearms, which are classically where we say possibly in a defensive type region, where you're trying to parry a blow or protect yourself.
Now, when we're talking about strangulation and someone is attempting to strangle an individual, how long would it take for someone to ultimately wind up dying as a result of that?
It doesn't take much to cause a person to pass out. Probably 15 to 20 seconds of a hold around the neck, as you can imagine from people that have a sleeper hold, or you've seen it in videos or movies, and that's real. In other words, it's the lack of blood flow to the head. The real issue is if you maintain that. If you release the pressure at that point in time, a person will return or regain consciousness. If you hold that pressure there for a greater period of time, probably beyond 30 seconds, you may not actually have a return to consciousness because the lack of blood flow to the brain was persistent. And that's really the issue. And in her case too, the question I have, obviously you have these injuries, and then you have the other injuries, the compressive injuries. You have hemorrhage in the back of the neck on the spinous processes, or as you can feel here, the big prominent one back here is called C7. There is C5, C6, and C4. All those vertebrae, or the bones of her spine, have hemorrhage around them. The other thing is there was actual hemorrhage around the membrane between the first and the second cervical vertebrae. And so what that tells me is that there was a significant force that went through that region while she was alive, because had she not been alive, I wouldn't have seen hemorrhage in those regions. And why that's notable for me is because that part of your spinal cord, as it goes upwards into our brainstem, is responsible for our ability to breathe. So we're sitting here breathing in, breathing out, not thinking about it. That part of our brain controls that involuntary activity. And so if a significant force is pushed through that region, you could also cause a person to stop breathing or die as well. So you have those two injuries occurring most likely while she was alive, therefore creating injuries that have a hemorrhage.
So in other words, she would have been aware of the fact that she was in the process of dying at that time.
She very well could have been, yes.
Could she have also been aware of the fact that she could have been strangled, could have come and still been breathing, and ultimately then sustained the blunt force trauma that she sustained to her ribcage?
It's quite possible, yes.
You don't know the order in which those injuries happened, do you, doctor?
I do not.
Okay. So can one have those multiple rib fractures and then ultimately be strangled, or vice versa?
Yes.
My God.
Could Diana Ruiz have survived these?
Absolutely horrible.
Given the severity of the injuries to the neck, I would say no.
And doctor, did you also fill out a death certificate in this particular case?
I did.
You may.
I do. This is a Florida state certificate of death.
And is that a certified copy?
Yes, it is.
Is that, at this time, Judge, the state would move Stacy Zimmer 31 into evidence?
Any objection?
No.
Be admitted.
Now, doctor, at the time that you were at the District 21 Medical Examiner's office back in October of 2019, as a deputy chief, did you also supervise the autopsy of a Miss Christine Melton?
I was involved in that, yes.
Could you please describe for us what your involvement was as it relates to that particular case?
Sure. At that time, I was the deputy chief medical examiner, and so it was very common for me to interact with all of the associate medical examiners at the office.
So now we're getting into Christine's. That's interesting. He was over everyone.
At the time, they were all younger than me, a little less experienced, and so I would very often talk with them daily about their cases. I would always go into the back in the morgue to see what cases were there that day, to see if the associate medical examiners had any questions, just to discuss their plan of attack, if you will, how they would approach a case. So that was something I did on this day with Dr. Hernandez, who was the primary doctor on the case.
Did you also have active involvement in the examination of Miss Christine Melton?
Yes, I did.
So remember, Dr. Hernandez was the one that we saw testify about Christine, but it looks like he was part of that as well. So I really look forward to this. I just want to say a couple things really quick. Sprinkle Donut says, God, she suffered terribly. I can't imagine the terror she felt. And I think we have to acknowledge that before we listen any further for both of them. You know, Melissa says, I think you must be required to watch the trial before reaching out to Wade. I agree. He put these women through pure hell. And look here, even Mila, who was his woman at the time. So all these women, do you think you would be any damn different? No. Hell no, you wouldn't. Sorry to break it to you. Annie says, he is petrified to be in his thoughts without substances or the women and men. I think he is aware he is a monster, and that is just a crazy thought. But, a lot of people are like that, especially if they've been in addiction for a long time. Hell, I remember at the point where I was petrified to be in my thoughts, but they weren't his kind of thoughts, But yeah, I could see that. Okay, so now we're going to hear about Christine. And then we'll be moving forward. I also really want to hear and look forward to hearing from Fannie, the homeowner, and we get to see the body cam footage from that. So, okay, here we go.
Observe all of those injuries. Yep.
And what, if anything, did you note were of any concern to you?
Sure. I mean, well, certainly, just looking externally, you can see that she had a large number of bruises on her body, on her face, a swollen eye, contusions around the eye, contusions around the mouth. She had bruising all over her torso, all over her arms. So it was suggested that she had blunt trauma. And being a young person, you always wonder if whether or not that could be, the cause of a person's death. And so similar to the injuries we describe here, when Noelle did the internal examination, you can see that there was a significant amount of hemorrhaging on both sides of the neck, within both, skeletal muscles of the neck. She also had bruising in her scalp, all over her scalp, as well as within the subscalp muscles. So again, showing significant blunt force trauma. Also, if I can continue, what was notable about this case was when she did the internal examination, she also saw that there was contusions of her internal organs as well. So forces that were directed to the outside of the body also went inward. And so she had bruising or contusions of the lungs. She had a contusion of the liver. She also had contusions on the back of her bladder, as well as contusions to her colon, indicating that there was a significant force to the abdomen as well.
Now, as a result of having observed the external as well as the internal examination of Ms. Melton, did you also conduct an examination of her brain?
I did, yes.
And what did that examination reveal to you?
Sure. I mean, it was a structurally normal brain, so there wasn't anything congenitally wrong, any brain masses or anything that would cause a person to die. But the interesting thing that I did see was the brain was swollen or edematous, and that to me fits with the injuries you observe on her scalp and around her head. It suggests that there was an underlying concussive trauma.
Oh my God, you guys. Not only did he, the blind rod and strangle her and the rib fractures, but he hit her head so hard her brain was swollen. That takes a lot. Think about that. Like, I've hit my head really hard. I wrecked a dirt bike once. And other times too, just like during sports, learning how to flip, learn in gymnastics. As you grow up, you hit your head all the time. You guys, I'm sure, have as well. And very rarely, you might get a concussion or something like that. And that is a hard hit. For your brain to be swollen, my God. I just can't. It's like, what kind of man takes out all their anger on a woman like this? Like, all their force, not anger, force, rather. That's a better word. Like, what a little bitch. Seriously, like, what a oh my God, he just infuriates me.
Because a brain can swell if a person is deprived of oxygen, but it needs time to have that process to occur. So if a person, let's say, you cut off oxygen or blood flow to a person's brain, and then you let them recover, that brain will swell. But if a person dies from injuries, and in this case, more than likely, she was asphyxiated from strangulation, she would have died, not allowing the brain to swell because of that process. And so it suggests to me that swelling occurred prior to that, probably from concussive trauma to her head.
And did you ultimately concur with the doctor as it relates to her findings that Ms. Melton died as a result of asphyxiation?
Yes.
Coward. Kelly brings up a good point. Wasn't that from her being run over by the car? I suppose it could be. I don't know. They haven't, I think that he lied. The way that I understand it, and you guys correct me, is that he didn't go back and forth over her like he said. Remember what was his name? The guy from the UK, Patrick. Where the heck is his name? The guy that was having breakfast and he witnessed it. He said it was only one time. Oh gosh, I got so many pages of notes here. Patrick Power. Remember him? So I don't know.
No further question for this question.
Just a couple of questions up here.
Yes.
Doctor, let's go back to Ms. Rudy's. I'm a little bit confused here.
Oh, here we go.
You can't tell me with any degree of scientific certainty as to what order these injuries occurred. Is that correct?
That's correct.
So it's entirely possible that she was unconscious from the strangulation at the time she incurred the injury to her neck and the ribs were broken.
It's possible.
Right, Millie, baby. Thank you. Gosh, I don't know why I did that, but you're 100% right. And I was thinking about Christine. Millie, baby, thank you for pointing that out. That wasn't about Diane anyways. That was about Christine. She's the one who that's who we were talking about, the rod injury and, the broken ribs. I don't know if Diane, I don't know, she may have too. It's new to me still. I'm trying to learn it all, but yeah, thank you. Setting us straight.
Now, the injury to the neck, were vertebrae actually cracked or broken?
No, you just had hemorrhage around there, which.
Okay. So there was pressure around that area.
A force, yeah, that had gone through there.
Okay. But I mean, is that part of the strangulation process? Is that an independent trauma that the back of the neck was exposed to?
could be a part of the, I mean, it's in the general region. So in other words, if I stretched my my hands are from the front all the way around the back, those vertebrae are in that general region, right? If you had a forced wrap around the neck. But you also have hemorrhage that goes deeper into the upper back muscles. And then you have those rib fractures that continue on, behind that. So it's likely that that also occurred from that large force upon the body.
But it sounds to me like your earlier testimony that the cause of death or primary cause of death was not necessarily from the rib fractures or from the asphyxiation, but was related more to the damage to the neck in the back?
Well, it's not necessarily. You have multiple injuries here, all of which could cause death, right? So take everything else out. The rib fractures alone would prevent normal chest excursion, really limiting a person's ability to breathe normally, right? So that certainly could cause death.
Okay.
Sure.
Let me just stop you there.
Yeah, sure.
She couldn't breathe. She may not have been able to breathe normally, but she still might have been able to breathe.
Yeah, but again, like I said, those injuries, if left unattended, you're asking me, that I only think that this could have caused death.
Right,
No,
right,
there's
right.
other injuries that could have caused death. That's why
It
I
doesn't
have my
change
cause of
anything,
death
dude.
more generalized.
But once again, you can't tell me with any degree of scientific certainty that she was conscious at the time that she sustained any of these other injuries.
I could not know.
What does this change anything? Like, I don't know. Is it like a tactic to confuse people in the jury or something? Like, that relevance emoji I made. Sure, it could be relevant questions. I don't know. It is within the scope of what they talked about, but it doesn't change anything. So, I don't know. Just want to be clear why I used the relevance. I understand that it could be, but I still think that it's just pointless.
With the regard to Ms. Melton,
But do your job, dude. Whatever. Whatever.
she didn't have the same injuries around her vertebrae, did she?
No.
She didn't have any broken bones?
No.
You mentioned that there was blunt force trauma, evidence of blunt force trauma to the head because there was hemorrhaging under the scalp,
That's correct.
but you couldn't see the hemorrhaging on the scalp itself, could you?
That's quite common that you don't know.
Okay. So, but I mean, I don't really understand. Well, that's what happens. I'm a lawyer, you're a doctor, so you explain these things to me. Somebody hits me on the arm, I get a bruise on my arm. All right, and that comes to the surface, and you can see that. How is it that you can get a contusion to your head where you can't see the bruising on the head? You can only see it underneath the scalp.
It's actually far more common than you think. Very common in injuries to the body. First of all, when you get a bruise or a contusion to the skin, it's because there's a rapid deformation or compression of the skin with a shear effect that causes a tearing of those capillaries in the skin. So it all really depends upon the level or surface at which that tearing occurs. If it occurs immediately beneath the skin, you're going to see bruising in the skin itself, right? Blows to the body. Very often you don't see bruises. Why? Because you don't have a bone immediately beneath the surface of the skin. So you're not compressing that skin rapidly against a structure causing tearing. So more common than not, you'll see nothing on the outside, but you'll see bruising on the inside to our internal organs, which we saw in this case. Now on the head, same thing. The head's a curved structure. If you have a glancing blow, you may not actually get a direct impact of the tissue causing rapid deformation and tearing of the vessels under the skin, but it may be more of a shear strain that causes the tearing of the blood vessels underneath the skin as scalp, skin, and fat move against each other like this. The blood vessels that course through there get torn, and that leads to bleeding in the tissues underneath. So very common, more common than you think. And as a matter of fact, it's very common for me to reflect the skin and see a greater bruise underneath the skin than I see on the outside of the skin.
Thank you. Because the lawyer was getting a damn attitude over that question.
Okay, well, and that brings us to a
Hold
point
it,
too.
buddy.
You see a greater bruise underneath the skin than you do on the surface of the skin, yet we would expect to see some bruising on the surface of the skin if it is blunt force trauma from like being hit with a hard, solid object.
Possible, but not necessarily.
Okay.
Much more common in younger persons to not see bruising. That's classic throughout the pediatric literature.
All right.
He's a damn good witness, you guys. I like him.
But you did say you saw hemorrhaging underneath the scalp, but you didn't see any fractures of any of the skull or anything like that.
No.
All right. So it wasn't trauma such that it would have cracked the skull.
No.
And we didn't have any. You already told us she didn't have any injury directly to the vertebrae. She did no cracked vertebrae or anything like that.
No.
Yes,
No, and then no injuries to the spinal column.
Not that we were able to see. No.
The injury to the head, could it have been from the same or similar compression that you had in the neck area? It didn't necessarily have to be a blow. It could have just been compression.
No, it would have compression to the neck would cause hypoxia or lack of blood flow. And if the decedent was alive long enough, then sure. But more than likely, me seeing just a generalized swelling in the brain, something I very often see in concussive head trauma.
Okay. Once again, with Ms. Melton, you can't tell us with any degree of scientific certainty how long she was conscious at the time she expired.
What
I could not
does
know.
that matter?
I don't have further questions. Thank
Okay, I get he's doing his job, but what does that matter?
you, sir.
Our next witness, let's see who we got
No further
now.
questions, Judge.
It says White Claw Wilson evades
you-
police. Just a second here. So we have Shanna. Okay. Here we go. I don't know what his point was, Sherry. I left your comment up because it was just what I was thinking the whole time with every single question he asked. So here we go. Shanna.
May I inquire?
You may.
Good morning.
Morning.
Please tell the jurors your name.
Shanna Williamson,
Ms. Williamson, where are you employed?
Benson and Associates Interior Design,
How long have you been employed with them?
10 years.
I'm going to show you State's Exhibit number 19. Do you recognize this exhibit?
Yes.
Does this exhibit show the interior design firm where you work?
Yes, our building is to the left and we had a design library in the building on the right.
So if I'm pointing to where the silver car is this part of the building there?
Yes, that's our office.
And then this area to the right of that, is that the,
That's a separate rental.
okay, so that's not yours
The gray building on the right is the design library.
over here?
Yes.
Okay. And which door is it?
It was the far right door. I'm not sure if you can see the
All
door
the way
right
over
there.
to behind this tree somewhere?
Yes.
Okay. And are those still your offices today?
The building on the left is yes, but the building on the right no longer is our office.
Okay. And you're still employed there?
Yes.
Can you tell us what exhibit number that is?
This is right by
Sure, it's
Mateo's
State's Exhibit
graphics,
19.
right?
Thank you.
Just so I can put it
I
in
want to
our,
take you back
in
to
your name.
October 7th of 2019. Were you working on that day?
Yes.
What time did you get to work?
Probably 7:15, 7:30 a.m.
Now, did anything happen once you arrived to work?
I was in the office and we had a design librarian at the time in the building to the right. And she was in there. She called us from the phone to the office on the other side. And she said, there's a commotion next door. Someone has hit one of my coworkers' cars. Looks like a fender bender. And there's an argument. You guys should lock the doors and not come out. And
Did you, so again, your coworker had to call because she's in the gray building and you're over in the other building.
correct.
When she told you to lock the doors because of the commotion, did you lock the doors?
No,
What did you do?
I went outside. I thought there was some type of a fender bender, so I wanted to go out and get insurance information for my coworker.
What did you see when you got outside?
As I was walking out the building, the girls in the office were telling me not to go outside because they had seen someone hit our neighbor next door, Mila. So I ran out there, and as I turned the corner, Mila was up on the second level, and there was a man up there with her, kind of grabbing her by the throat, and they were having an altercation.
And you said Mila was your neighbor. Did you know her well?
No,
Just somebody that you knew in passing?
right?
And what color was Mila's hair at the time?
Blonde.
So when you got outside, they were already upstairs on that
On
second
the
level.
Second level balcony.
Where were they at when you observed the man with his hand on her neck?
Second level balcony.
Okay, so were they, I'm just going to point to the picture here. Were they closer to the stairs or more over
They
toward
were
her spa?
farther to the right on the second level.
And the man that you saw with his hand on her neck, could you describe what observations you made of him?
Tall, was not
imagine?
wearing a shirt, was being very aggressive with her.
Okay. And you say he's being aggressive. Could you just describe to the jurors what it was that you saw that caused you to determine he was acting aggressively?
Yeah, when I walked around the corner, I had heard the girls in the office say, "Oh my God, he hit her." And as I walked around, I could see him holding her up against the window, and she was screaming, saying, "Help, he's trying to kill me." And I saw that, immediately shouted, "Stop, let her go. What are you doing?" And he turned around and saw me, and I think it caused an interruption. She was able to get away.
So when he has his hand on her neck and she's yelling, "Help, he's trying to kill me," what type of voice was she yelling in?
Screaming.
Did she seem terrified?
Yeah, very scared.
And when you yelled at him, describe what he did.
He turned around and he was in a way defending himself. I believe he said, "She hit me first," or I know he was trying to kind of defend his actions, basically.
So when you yelled at him, did it cause him then to turn around and engage with you?
Right.
Wow. So he turned around and said, "She hit me first." Oh my God.
Once he engaged with you, was she able to get away?
Yeah, so I was saying, "Run, like come run."
Wow, you guys.
So she was able to run down the hallway, down the stairs, and my coworkers were in the building at the time. The door you can see on the left there, they unlocked that door, and we both went inside that door and locked it.
And the
behind us.
door that you're talking about, is it the one by the car?
Correct.
So you told her to run, she was able to run in, and then you locked the door?
Right.
And did you keep it locked until law enforcement came?
We did.
Did you ever see the man that was strangling her again at that moment?
No, we did not see him again.
May I have a moment, Your Honor?
You may.
At this time, the state tenders a witness.
Okay.
That was quick.
Then from your angle, how close did you get to the two of them?
I was standing probably about where that silver car was, a little bit to the right, maybe.
One on the left of the photo?
Correct.
And where were they?
They were on the second level balcony,
In the building
In
in the back.
the building in the back.
Did you ever see him hit her?
I did not. I don't recall seeing him hit her.
Okay. Thank you.
I have nothing further, Your Honor, and ask that she be excused.
All right, you can step down. Any objection for being excused?
Okay.
Objections. You're excused. State and call their next witness.
Yes, Judge, say we call Officer Tim McCormick.
So I think this is where we get our body cam footage.
Good morning, sir.
Good morning.
Please introduce yourself to ladies and gentlemen of the jury by telling them your name.
My name's Timothy McCormick. I was a police officer at City of Fort Myers.
How long were you an officer with the City of Fort Myers?
Just over 15 years.
Back in October of 2019, were you a police officer at that time?
Yes, I was.
And how long had you been working as a police officer at that time?
Just under 13 years, I believe.
And what were you doing? What were your duties and roles as the police officer back in 2019?
At that time, I was a senior patrol officer, and I was on alpha shift and assigned to patrol.
What's a senior patrol officer do, sir?
Basically, we respond to calls for service, assist the public in any way, shape, or form, and protect and serve the city of Fort Myers.
When you say alpha shift, what do you mean?
That's the assigned shift. Shifts are broken into 12-hour periods, and I was on the alpha shift from 5 a.m. to 5 p.m.
Now, specifically directing your attention to the 7th of October of 2019. Were you working on that day?
Yes, I was.
Did you have occasion to become involved in an investigation involving a battery that occurred at a spa known as Mila's Spa, involving a young lady by the name of Melissa Montanez?
Yes, I did.
And what was the extent of your involvement in that particular case?
I was called to the scene of a reported battery on West First Street in front of the Mila Spa. Upon arrival with other officers, we made contact with the victim.
And was the investigation ultimately turned over to an officer to conduct that?
That's correct.
Okay. And what did you do in response to turning that investigation over to that?
So now I'm confused what body cam we're going to see. Let's look. We have him on direct. Then we have body cam footage. I think it's Wade in the car. You guys that know, let me know if I'm wrong. So when we do our wrap up, after we get to the sentencing, the final thing, the finale, the final thing we will do regarding the trial is, like I said before, go back to the 911 call. I want to hear that. We didn't get to hear it very clearly. Watch Mila's interrogation, but I'm more interested in Wade's, honestly, and then some of the body cam footage. Maybe I'll find and kind of clip or get timestamps for certain parts so we don't have to sit through it all. I'll probably do it that way. But yeah, okay.
That officer.
I turned the investigation over to the officer and I patrolled the area to see if the identified subject would possibly still be in the area.
And were you able to locate him?
Not at the initial time, no.
At what time were you able to locate him?
I was contacted by an acquaintance and said that
Objection, hearsay.
Sustained.
Did you receive information with regards to the whereabouts of a individual who later became known to you as Mr. Wade Wilson?
Yes, I did.
And when you received that information, what did you do in response?
I responded to the area and looked for the described vehicle and the person that I had identified as Wade Wilson by his driver's license photo and the photo in the LCSO records.
And when you say you went to a specific location, which location was that?
It was Joe's Crab Shack on West First Street.
And when you made contact with that individual at Joe's Crab Shack, were you also wearing a body cam?
Yes, I was.
What exactly is a body cam?
A body worn camera is a camera that all police officers issue.
Well, here we
And the
go.
Standard policy at Fort Myers Police Department, as most police departments, is that as soon as you respond to as soon as you get the call, you activate
You didn't
your,
distract you. You guys,
body camera.
yeah, don't apologize.
Also,
I
in
didn't.
our cars, we have an automatic system where if you turn on the overhead lights, it automatically starts your body camera.
And were you wearing a body camera on that particular date and time?
Yes, I was.
Judge, let the record reflect between defense counsel previously marked cases number 34 and 35.
Is it 34 and 35?
Yes, Your Honor.
Oh, I'm so sorry that happened. Yeah, don't apologize. It's okay. Hey, Melissa.
You may.
McCormick, I'm showing you some previously marked states number 34. I ask you to take a look at that item. Do you recognize that?
Yes, I do.
And what does that appear to be?
That appears to be the parking lot of Joe's Crab Shack.
Okay. Does that photograph fairly and accurately depict the parking lot there at Joe's Crab Shack?
Yes, it does.
And I'm also handing you with some previously marked states number 35. Do you recognize that?
Yes.
How do you recognize that?
This is the recording of my body cam.
Okay. And does that body cam fairly and accurately depict your interaction with Mr. Wilson on the 7th of October of 2019?
Yes, by my initials, it does. You showed it to me in your office and I initialed it.
Okay. And it's essentially the same or similar conditions when you last saw it?
Yes.
Judge, state move states number 34 and 35 in evidence at this time.
Objection. Be admitted.
Permission, public judge?
You may.
So we're looking here at State's exhibit number 34. That is, in fact, the parking lot there of Joe's Crab Shack?
That is.
Where in relationship to Mila's Spa is Joe's Crab Shack?
It's, if you're sitting in the parking lot of Joe's Crab Shack as it's depicted, and your car was backed into a spot, say next to the white car right there. If you look to your
Wow,
left
so it's
across
close.
the street is where Mila's Spa would be.
I didn't realize it was that close. Interesting.
Now, when you made contact with Mr. Wilson, could you please describe what his demeanor was like?
He was, he seemed nervous, and when I spoke to him, he seemed a little defensive and uncooperative.
Did you know anything he was wearing at the time?
He was shirtless, and I remember he was wearing a pair of pants that seemed to didn't fit him at the time.
So I have a question. I'm a little confused on the timeline. So for those of you guys who know it better, this happened after the murders, but before he went to Fannie's house, right? Correct me if I'm wrong.
And do you see the person that you made contact with there at Joe's Crab Shack in the courtroom here today?
Yes, I do.
Would you please point him out and describe an article of clothing that he's wearing?
He's sitting to my right, and he's wearing a suit with a black tie.
Judge, let the record reflect the witnesses identify the defendant as well.
Okay.
Permission to publish the video, Judge?
You may.
Thank you, Tess. So he still had blood on him at this moment, right? But I guess he doesn't get out of the, let's see what happens. I don't know. Wow.
How you doing? What's going on, man? You're waiting on your girlfriend? Oh, okay. That's no problem. No, I got a call. Somebody was sitting in their car and everything like that. So. Oh, okay. She's on her way now. Mm-hmm. Okay. Okay. L41 to bike 5.
Okay, so it seems you guys said that I was right about the timeline. And then Fannie is the woman who lived in the home. She had a vacation home. I think she's from Ohio. She had a vacation home down in Florida, and she had just left her vacation home. When Wade goes there, that's where he goes, showers, eats, drinks, talks to his dad, and eventually, gets caught. I think today, in just a minute, we're going to see photos of the house, Fannie's house, and the way he left it.
ETA? Copy on 10-12. I'll explain it to you when my partner gets here, okay? Yeah. How about this morning? Say again? Yeah, I can do that, but I'm just waiting for my partner to get here. Yeah, absolutely. And here's what's gonna happen. Is the car running? Shut the car off for me. It's off. I'm gonna detain you until I figure out what exactly is going on. Wait, you don't want any trouble for me? Okay? Okay, yeah, that's what I'm saying. So I'm going to have you step out of the car, and I'm going to detain you. Not arrest. Detain you right now. Okay? And I can't have any problems. You understand me? All right. What's that? Bike 5, I'm at Joe's Crab Shack in the parking lot. I will.
Oh my gosh.
I give you my word.
So Tess says, I want to read Tess's comment to you guys in case, you hadn't seen the trial before, just to kind of keep things on the timeline. He's wearing the original outfit still. Yes. So the sweatpants and no shirt. Remember, he knocks on, he goes to Mateo's Graphics covered in blood, no shirt, no shoes, pair of sweatpants. He's still in that outfit. She says that's why he's so nervous. He knows about the murders. They do not yet. So at this time, all they know is about Mila.
I have to detain you. By our procedures, I have to detain you. Because of the battery this morning. There wasn't any battery? I will. No. Just relax. Let me see the keys to the car. Let me see the keys to the car. Keys. Keys. Wait, we're not going to have any problems. Just give me the keys to the car.
Wow. Oh my gosh.
Wait.
Lovely lyrics. Oh, Melly, for sure, sweating.
Wait till my partner gets here.
Was it Hope?
No,
I thought she was at like 6 a.m. that day.
Go anywhere.
Like on her way to work. Uh-oh, there he goes. Oh my gosh. Okay, Alexander. It's after Mila and Christine before Diane, I believe. I'll have to double check that, but I thought he went to Mateo's after Diane. But maybe I'm wrong. Heck, I don't know. That's the way I understand it. Yeah, because he told Mateo's Graphics, I've killed some people. And Diane was walking to work at like 6 a.m. And this right here happened at, what does it say? 15:21, so 3:21 p.m.
He's in his car.
On the 7th. Yeah, so this is after. If you look in the right corner, we can see the timestamp. 3:21 p.m. on October 7th, 2019. So it would have been after everything. Yeah, it would have to be Tess because that happened very early in the morning with Diane, and then he went to Mateo's after. Yeah.
Take off.
We can double check this though, you guys. Thank you, Valerie. Thank you, Melissa. You guys rock. Thank you.
Ran a stop sign
Very smart.
going up towards McGregor.
Diane left for work between 9 and 11, Venomous Vixie says. So maybe I'm here remembering 6 from Christine. I believe that's when Stephanie did Stephanie leave at 6 then? Because she had to go to work and stuff? Oh gosh, I don't know. I'm learning with you guys, so just remember that. Many of you guys know a lot more than me, but I'm learning as we go. I need to make a visual timeline for us, just like of the basics, so we can keep track of this stuff a little bit easier. I'm sure there's one somewhere online I can find too.
And Mr. McCormick, when you made contact with Mr. Wilson,
Oh, thank you, Carrie Ann.
did he appear to understand everything that you were telling him?
Yes.
And was he responding in kind to you?
He was basically denying everything that I was asking him to do.
When you're having a conversation with him, you're giving him certain commands and you're asking questions of him. Is that correct?
That's correct.
And was he responding appropriately? By appropriately, I mean, if one asks you if you had breakfast this morning and one would respond, yes, I had cereal, that would be an example of appropriate response. Was he responding to you appropriately?
Not complying to my commands, but yes, he was responding appropriately.
And when you told him specifically about a battery that occurred that morning, what was his response to you?
That there was no battery.
And he continued to deny that.
That's correct.
And when you advised him that you were going to detain him, he opted to leave the scene as an alternative choice to what you were telling. Is that right?
Ultimately, yes, that was the outcome.
Is there anything else in that video that we were not able to understand that you recall specifically that Mr. Wilson had told you?
Not that I recall.
Did you follow or did you continue to follow him?
I did for a short period of time.
Okay. Why did you stop?
Because of the time of day and the amount of traffic on the road. It was around lunchtime. It's somewhere there near lunchtime, and the amount of people on the road. At the time, I only had a non-pursuitable offense.
What does that mean?
That I only had misdemeanor battery at the time.
Yes, sir.
So therefore, there was no probable cause to continue any type of pursuit or have any other officers try to locate him at the time because of the nature of the offense we were dealing with.
And would that have been the protocol of your office?
Yes, that is.
Okay, fair enough.
Life and safety of the community comes first.
Thank you. No further questions for this registration.
Any questions?
Okay, so now I think.
All right. Oh, step down.
Thank you, sir.
No, actually, no cross. So now we get into Fannie and the photos from the break-in. I'm trying to find a timeline, guys, but if that was after both of them, which is what makes sense to me because Diane was already long gone from work at 3. That body cam was at 3 in the afternoon. So I don't think it could have been. I think it had to be after both, but I'm going to find a timeline just to be 100% sure or create one, go back and listen to the testimony. But if it was after, remember all the evidence that is on and within that vehicle. It was before her 10 a.m. shift. But they were pulled over at 3. The timestamp in the body cam footage says 3. See, timestamp wrong. It's lunchtime. It could be wrong because we've seen that before. Okay, well, let's see. We do know that he went to Josh's after both, right? So, yeah, Diane went to work in the morning. The office just said it was lunchtime. Well, we will see. I'll try to see. But regardless, I'll try to iron that out so we know 100% factually. Thank you, Tess. Let me know if you find anything. I'm looking too. But it's not uncommon for those body camera times to be off. You guys aren't wrong. I've seen that before. They will adjust them, just count for the loss. Now, if that's the case, if it was before, my God. Which not only that, look, this could have been prevented back in February with Kelly. Right? Okay. Seems like we're all kind of torn on
May I
that.
inquire, Your Honor?
You may.
Good morning. Please state your name for the record.
Fannie Amlin,
Ms. Amlin, where do you currently live?
Columbus, Ohio.
Did you have a house here in Cape Coral back on October 7th of 2019?
I do remember, Nicole, that they did say something was off by an hour, but which was it, that body cam or a different? Because I thought it was something else. Could have been prevented a long time ago, right? The timestamp is wrong. Yeah, I think you guys could definitely be right about that, but All right. I think well, there's a way that we can definitely iron that out to know for sure. And I'm going to make damn sure we do, because I want to know the facts and have them correct. Okay. So this is going to be interesting. We're going to hear from her for about, let's see, 5 minutes, and then see photos of the house, what he did in there.
I did, and I still do.
Okay. What is the address of that home? Were you at that house on October 7th, 2019?
Yes,
Did you leave the house at any point?
yes.
Could you just tell the jurors where you left to go?
We left to go to the airport to go back to Columbus.
What time about did you leave your home?
It was early morning, maybe 8:30. Early, I'm not sure.
When you left your house, was everything picked up and in its place?
Yes,
And were the doors locked?
yes,
And did you plan on having any guests or company staying at your house?
no,
At some time, did you receive a call from detectives once you had gotten to Ohio?
yes,
And did you learn that someone had broken into your home?
we did, yes.
Again, had you given any permission for someone to come
No.
to your home? And did you know the person that they found in your home?
No,
Had you ever spoken to Wade Wilson?
no,
Had you ever seen Wade Wilson?
no,
When he was arrested, he had told detectives he had taken some things from your home. Did you ever give permission for him to take anything
No.
from your home? Your Honor, may I approach the witness?
Yes.
For the record, I'm showing defense counsel states exhibits 36, 37, 37A, 37B as in boy, 37C, 37D as in dog, 37E, 37F, 37G as in girl, 37H, and 37I.
okay,
Do you recognize these photographs?
yes,
And do they clearly and accurately represent your home?
yes,
At this time, the state would move exhibits number 36 and 37, and then 37A through I into evidence.
Any objections?
No objection.
All right, be admitted.
All right, Ms. Amlin, is that your home?
yes.
We identified the exhibit.
36?
Thank you.
And
I
I'm
feel
going to
bad for
start
her. Imagine if you were in her shoes.
37. Is this a window?
Okay, before we get into these pictures, Melly Belly, you are so right. This poor woman is alive by the grace of God. If she had been home, he told his dad he would have killed her too. And she had just left. That is wild to me. So I know that Melissa's coming on soon. I will make sure by tomorrow when we start for tomorrow, and maybe we'll start at 5 instead of 5:30, so we'll have more time. because we could do the daytime, but it's better. Like we did a poll and most people wanted to do the evening. But by the time we start tomorrow, I will make sure I have it ironed out where we know 100%, you know, what was first and when that body cam took place. Okay, Tess. Okay. Thank you. All right, let's look at this and then we'll look at it before we go. I think, hold on, let's
Go
just.
to your home.
Yes,
Now, it appears that there's a pane of glass or some screen that's been removed. Was that removed prior to you leaving for Ohio?
no,
Okay, so there was a screen and glass there when you
Yes.
left. Now I'm showing you 37B, the screen and glass. Are those is that the screen and glass that was part of that window?
yes,
And were those actually broken?
yes,
And did they need to be repaired?
completely.
And how much did the repair cost approximately?
We think about 250. We bought a new window and put it in ourselves.
Okay, so around $250 for that. Then going to the inside of your home, actually I'll stay on the outside, 37A, we see the window and the screen behind that structure. Again, were those there when you left for Ohio?
No,
Going now to the inside of your home, 37C. Do you recognize that backpack or anything on the counter or the stool?
the backpack, yes,
Okay, and whose backpack is that?
that's ours.
Okay, and was that backpack left on the chair before you
No.
left? Where was the backpack located?
In the bedroom.
And then what about this, looks like actually pants and shirt and belt that are sitting on the counter?
Those are probably my husband's.
And did your husband leave the belt or shorts or shirt on your kitchen counter?
No,
And if he had, you would have put them away?
right. We don't do that.
Then looking at 37D, that's just a close-up of a hat and backpack. Do you recognize that orange hat?
Not the orange hat,
Okay, but the backpack.
the black
you mentioned.
backpack, yes.
Now, looking at 37E, that's just the clothing that was set on top of your kitchen counter. Is that clothing, does that belong to your husband?
Not those two,
Okay.
no,
And so you don't recognize those or know where they would have come from?
no,
But again, they weren't there when you left?
no.
Looking at 37F, do you recognize that belt?
Honestly, no. I don't pay too much attention to belts.
All right. And when we look back at, actually, I'm going to just go on to the next one. 37G, did you leave your cupboards open?
No,
Oh, my God, dude.
37H,
He's
it appears there's some White Claw empty cans and some, like a plastic Solo cup. Did you leave those empty cans in your cupboard there?
no,
bag of
And did you
popcorn in the
ever
floor.
keep White Claw cans in your cupboard in that area?
no,
Solo
Look at
cup?
that again. Is that a bag of popcorn in the floor and two White Claws and a cup?
Did you leave those empty cans in your cupboard there?
no,
And did you ever keep White Claw cans in your cupboard in that area?
no,
Then 37I, there are 5 empty cans of White Claw. Are those alcoholic beverages?
yes,
It's like a seltzer.
yes,
And did you and your husband have some drinks before you got on the airplane?
no.
Okay.
Those are in the
And
refrigerator.
so were those White Claws left out empty when you left?
No,
So all these are different from how you left.
yes. Those are all full and in the refrigerator.
And about how much does White Claw cost?
I think about $15. It did then, probably more now.
Now, did you end up, both you and your husband, give a statement to law enforcement?
When?
Did you just tell them about what happened when they contacted you or that you didn't give him permission?
Oh, yes, I did. I was the only one up.
May I have a moment, Your Honor?
You may.
Nothing further. The state tenders a witness.
No cross-examination.
All right. You may step down.
One second, you guys. So tomorrow we're going to have Lieutenant Brian Tooley. He's going to go through a lot of the evidence, DNA analysis. Oh no, wait, that's what am I? I'm reading Karen Reed. I thought that name sounded familiar.
The state calls Daniel Baker.
We're still going to go through the evidence, but not with Tooley. We're going to go through with, we'll have Daniel Baker. I'm not sure exactly who that is. It looks like that they bring in some evidence bags that he's going through, maybe some clothes. Then we will have detectives meet with Wade in jail. I look forward to that. And then closing arguments. I think a lot of our questions will be answered as we continue to watch. But Tess did send me an article that can try to help us clear up what we were talking about just now. So let me see. I've got it right here. Watch Wade Wilson's shirtless body cam video hours before murder arrest. Let's read this. A shirtless Wade Wilson drove away from a police officer who detained him, and wild body cam footage taken on the same day, the Florida man brutally killed 2 women. Wilson, 30, will be sentenced to either death or life in prison on August 27th for the killings of Christine Melton and Diane Ruiz within hours of each other on October 7th. In police body cam footage from October 7th, obtained by Newsweek, Fort Myers police officers responded to a call from Wilson's former girlfriend, Melissa Montanez, who claimed Wilson attacked her in the parking lot of her business. She told police she had taken her car from a bar the night before and left her stranded at the establishment, and she simply wanted it back. He had. Wilson arrived at Mila Spa in a black Nissan Versa he had stolen from Melton after he met her at the bar the night before, went home with her, and then strangled her to death in her bed. Shortly after Wilson left Montanez, he saw Ruiz walking down the street and stopped to ask her for directions. Ruiz got into the car where Wilson strangled her and then ran her over. And then they quote the spaghetti quote, which we know he didn't. He exaggerated, it seems, a bit there. Parts of the body cam footage were previously shown in court on June 11th. In one clip, an officer claimed he got a tip that Wilson may be in the parking lot of Joe's Crab Shack and found him there in Montanez's car. Wilson told the officer he was there waiting for his girlfriend. I'm going to detain you, not arrest you right now, okay? I can't have any problems. You understand me? The officer asked Wilson, although the convicted killer's responses are difficult to hear. So it seems that the way they're explaining it, it is in that order. It says he then fled from police when they arrived and was later found in someone's house. The homeowner not at the residence and told police that Wilson was not permitted to be inside the home. Yeah, look here. Wilson told police he knew he was wanted for battery domestic violence, so he broke into the house through a rear window. While inside, Wilson showered, ate popcorn, so it was popcorn, drank 5 White Claws, and stole the victim's clothes, which he was wearing when arrested. Now, let me see here, because Nurse Kristen mentions law and crime. I want to see if we can get any clarification before we go. Hold on. Give me just 1 second. I want to check when. Just 1 second. Okay. Sorry about that. I just want to make sure Melissa goes live at 8, and I want to make sure it wasn't 7:30. Let's try to get some clarification on this timeline while we're here. I want to do the law and crime search and also look at this. Let's see. Is it on their website, Law and Crime? Daily Mail might have some information. Let's go there instead of People. Just to see if we can clarify. He's seen on body cam footage driving away from a police car while shirtless the same day he brutally killed his 2 female victims. And then he had attacked Mila at the spot and stolen her car. In the clip, which was shown in court, he was found without a shirt in her car outside a local restaurant and tells an officer, well, this is not correct because it wasn't her car. See, they got it wrong even there. We know it wasn't Mila's car. Doesn't really say. The same day. Well, yeah. Okay, so let's think about it like this. Didn't both of the girls, Christine and Diane, live in Cape Coral, but the attack on Mila was in Fort Myers? So how close is that? And did he go back and forth? Here he is before all the face tattoos, you guys. Hey, Allie B. Yeah, the article infers that. We're going to get better clarification, though. It seems like it was Christine, Mila, Diane, body cam. And then after that, he goes to Mateo's, but I'm not 100% sure. We will get clarification, daggone it. I'm telling y'all. Oh, God. Wade Wilson adjusts his suit during his capital murder trial at the Lee County Courthouse in Fort Myers on Monday, June 3rd. There's Diane. Christine. Okay, let's see if People can give us clarification. No. My goodness, you guys. Well, like I said, I will find it before I come back tomorrow. I wish that they would clarify when these, when they post the footage, but so if she was conscious, Diane, that is an aggravating factor. I'm not sure, Sue. I don't think they could clarify. You remember, the lawyer was asking questions about, which injuries happened first and loss of consciousness and that kind of stuff, and they weren't able to clarify all of that. Fort Myers and Cape Coral are separated by a small bridge. Hey, Chedaskadum. I don't see what's so good looking about him either at all. Oh no, Kitty Cat Princess. So many awesome people. Okay, let's just look for one more thing and then I'm going to let you guys go. And tomorrow we will rejoin and hopefully have more. I'll have more answers, but for that, because it's going to bother me until I do, for 100% have it outlined by time, There's also the body cam of him going to Mateo's Graphics. Yeah. I guess we will see. I'm not going to keep leaving y'all hanging just because, I'm not finding anything that quick. But yeah, thank you guys for being here. thank you for my new word, because it's been very interesting, but seriously riveting. I have hung on to every detail. Sometimes with stuff like this, though, for me, I need to see and hear stuff a couple times before I really have a good grasp. So I feel like I'm grasping the majority of the information, and who the witnesses and who they are. And part of that, it's helped by like timestamping the video. It kind of irons it in my head, but I'm not grasping everything, you know? So Roro, thank you guys for helping fill in the little puzzle pieces for me. I really appreciate that. Like I say, like you guys are some of the funniest, most brilliant, educated, just loving people, and I appreciate you guys. Jahira, we will find out if anybody is able to find anything yourself and you want to, email me. Let me put my email on here. Just send it to alexerickson@gmail.com. So the way that my name's spelled on the channel, send it to Alex Erickson. Yeah, let me know. And otherwise, I'll see you guys tomorrow, I think around 5:00. And yeah, we'll go through some more. I really cannot wait to hear the testimony about his interrogation. And I can't wait to see that as well. So anyways, thank you guys. If you are coming in late or watching on the replay and you want to know what you missed, give me about 10 minutes and the description will be full of all the timestamps where you can find what you're looking for. Make sure, we're doing the comment section segment at the beginning. I love hearing from you guys. It's really one of the reasons why I love to do this, like the back and forth, the discourse. So please, if you have anything to add, feel free to leave a comment down below, even if you were here the whole time. And yeah, I'll see you guys tomorrow. And I'll see you tonight over at Melissa's. I don't know if Jen has a live, but I do know that I have a couple interviews planned, one being with Jen that will be pre-recorded and then posted. So keep your eyes out for that too. And yeah, thank you to everyone. Thank you to my mods. I appreciate you guys more than you know. And I hope you have a lovely night and I'll see you tomorrow. Bye.